Hello and welcome back to Lori Medicare Essentials, where we equip agents with the knowledge they need to confidently guide clients through their Medicare options. Today, we're going to cover Medicare Advantage, also known as Medicare Part C. We'll talk about how it works, what it covers, and key points to help educate your clients effectively. So, what is Medicare Advantage? Medicare Advantage plans are an alternative to original Medicare administered by private insurance companies. These plans bundle together hospital Part A coverage, medical Part B coverage, and usually prescription Part D coverage all into one plan managed by a private company. Since these plans are managed by private insurers, they replace original Medicare's cost-sharing structure with their own set of copays, coinsurance, and out-of-pocket maximums, offering a more structured way for clients to budget their healthcare expenses. Even though Medicare Advantage or Part C plans do set their own copay and coinsurance style structure, it is important to remember that they are all required by law to cover the same services as original Medicare A and B. Instead of Medicare setting the cost structure, though, the plan itself determines things like copays at the doctor, for surgery, hospital stays, and other procedures, coinsurance amounts, and the annual out-of-pocket maximum, which original Medicare does not offer. In most cases, the cost structure of Medicare Advantage is more beneficial than original Medicare, as it provides predictable copays and an annual cap on out-of-pocket expenses, offering clients better financial protection. Agents should ensure that clients understand how these plans manage costs and how they compare to original Medicare's unlimited 20% coinsurance, so clients are empowered to make the best coverage decision possible. In addition to the coverage for hospital and medical that Medicare Advantage plans provide, most also include a Part D component to help members get their prescription drugs paid for. This means medications are covered under a tiered formulary system. Tier 1 generics usually cost the least, while brand name and specialty drugs are a higher tier and cost more. Plans have different formularies or list of covered drugs, so it is really important to check if your client's medications are covered. And some plans do have a deductible, and clients will experience copays and coinsurance at the pharmacy while they use the coverage. As an agent, it is important that you check and review all of your clients' medications and tell them exactly what they can expect to pay at the pharmacy so they don't have any surprises while they use the coverage. For more details on Part D, make sure to click the link up at the top right-hand corner of your screen, as we have a video going a lot more in depth so you can learn the ins and outs of Medicare Part D. Along with the hospital, medical, and prescription coverage that Medicare Advantage plans provide, most also include other extra benefits that original Medicare doesn't cover. These added benefits can include things like dental coverage for services such as cleanings, exams, and comprehensive procedures, routine vision care including eye exams and help paying for glasses or contacts, hearing benefits like hearing tests and hearing aids, gym memberships through programs like Silver Sneakers that allow seniors to belong to a local gym or do local fitness classes. And finally, even over-the-counter or grocery allowances to help pay for things like pain relievers, allergy meds, meat, seafood, or vegetables from the grocery store. These benefits can vary by plan, so it's important for agents to review what's included and highlight the extras that matter most to each client. These perks can really set a plan apart from another, especially when clients are comparing their options side by side. By explaining the extra benefits from each Medicare Advantage plan in detail, it empowers the client to know their options and make the best decision about their coverage possible. Now that you know what Medicare Advantage plans cover, let's take a quick look at how they work behind the scenes. It's just as important to understand the structure of these plans as it is to understand the benefits themselves. Medicare Advantage plans are network-based. This means that they work with a set group of doctors, hospitals, and providers to give coverage. Most plans operate as an HMO or PPO, and your client will typically need to see an in-network provider to get the lowest cost possible, or in some cases to receive care at all. Because Medicare Advantage plans are network-based, you want to make sure you are checking doctors on every appointment to ensure they are in network with whatever insurance company you are enrolling your client in. In addition to using provider networks, most Medicare Advantage plans also require prior authorizations for certain services. This means that before a test, procedure, surgery, or to get certain prescriptions filled, The insurance company needs to approve the service to ensure it is medically necessary. Prior authorizations sometimes take time, so to get certain care, it might take a little bit longer than if the client just had original Medicare by itself. As an agent, it's important to set expectations with your client so that they understand that while Medicare Advantage plans offer more predictable costs and valuable extras, they do come with more rules and oversight compared to original Medicare. This structure helps to keep premiums low and benefits high, but members need to be aware of this process so they can ensure they are making the correct decision when it comes to their health care and their Medicare plan. Before I let you go, I want to give you 5 key takeaways about Medicare Advantage plans that every agent needs to know before meeting with a Medicare beneficiary. The first is Medicare Advantage is an alternative to original Medicare. These plans are offered through private insurance companies and they bundle together hospital Part A coverage, medical Part B coverage, and usually prescription Part D coverage all into one plan. They also often include additional benefits like dental, routine vision, hearing, and fitness memberships that original Medicare doesn't traditionally cover. While these plans set their own cost sharing like copays and coinsurance for certain covered services, they are required by law to cover all the same services as original Medicare A and B, so you can rest assured that all the services that would be covered under Medicare are also going to be covered under your client's Medicare Advantage plan. These plans are network-based plans, meaning members typically need to use doctors and hospitals within the plan's network, and also they typically require prior authorizations for certain covered services to ensure that they are medically necessary. To enroll in a Medicare Advantage plan, clients typically need to have Medicare Parts A and B already. This is a key eligibility requirement that can't be overlooked before you do an application. These points are essential when helping your clients understand if Medicare Advantage is the right option for them, as everybody has their own unique set of needs, and our job as agents isn't to sway them between Medicare Advantage or original Medicare, but instead to empower your client to understand their options so they can make the best decision possible.